Welcome to Continuing Education Module, What to Tell Leaders About Bottom Line Impact. What level of economic return should you expect? Our agenda for this particular module includes the provision of some key definitions, how we position and potentially can position wellness, some of our econometric assumptions, the statements that we might make to management, some reasonable expectations for return, and a summary of key points. Key definitions to start with. First of all, we define economic return as the monetary benefit, the savings associated with a program, and it's usually expressed in dollars or in currency related to the country involved. In addition, return on investment is the monetary benefit or savings associated with a program divided by the cost of that program expressed as a percent. So that's what we are doing when we're converting the investment that we make in a program and compare it to the potential economic benefit or monetary benefit, and then express that as a percent. Cost benefit return is what our literature tends to present this issue in, and it's the monetary benefit or savings, and in all three cases of economic return, return on investment, and cost benefit ratio, we're talking about the same amount of monetary benefit or savings associated with a program divided by the cost of that program, and that's what we're getting to as a sense the net economic return from an activity, and it's expressed as an integer and or a decimal. So that means that a 3.0 cost benefit ratio would be $1 of cost to $3 of benefit, and that would equate to a 300% return on investment. Another one of the definitions we want to cover is net present value. Now, NPV is a commonly accepted way of estimating the time-adjusted net monetary benefit or savings associated with a program expressed as a dollar amount. So what we're doing with the NPV is we are really attempting to determine what is the net present value or economic effect of something like a program. It's used in a general sense in the financial management world when we want to look at potentially different investments and look at what the adjusted monetary benefit of that particular activity would be. So we generally want to look only at NPVs before we have done any programming, and we want to use NPV methodology to determine what the likely return or the likely economic effect of a given activity like a wellness program might be. And this is expressed in a dollar amount. So theoretically, any NPV greater than $1 means that there is greater than a dollar cost. The dollar cost of the program, the return is greater than that. So from a theoretical kind of standpoint, you would basically say an activity is justified if it has a positive NPV. But obviously there are lots of other things to take into consideration when you are considering doing different kinds of activities, like launching a new product line or building a new building or investing in a particular change in your parking lot or changing the size of your workforce. So NPV is a common method for us to be able to look at alternative uses of capital. Now, our positioning wellness, we can generally look at what might be called the value on investment issues and the issues around return on investment, which is where we have put a monetary value and an economic value on our program. Well, the general ways that we generally look at this issue of positioning wellness is wellness a primarily humanitarian reason? And are we doing the wellness program for a humanitarian reason? Recently, I had a client that wanted to simply help employees feel better about being employed with this particular employer. So they were not interested so much in the economic issues. They were interested in how do I, in fact, improve the sense of my employees' value of being part of our organization. So that would be a humanitarian reason for doing wellness. I can also position wellness so that it's designed to help me recruit new employees and or retain existing employees. So that again would be another reason for why I might invest in a wellness program. I can also do morale improvements. So I can help people's sense of morale by being able to maybe address wellness issues, particularly if they have not either found time or motivation to do this on their own. It's making it easier by putting it in the work site, putting it during the work day can be a way of enhancing morale. Another positioning issue in wellness is stabilizing our medical trend on our health plan. So if we are concerned about future healthcare costs, we can invest in a wellness program to help us stabilize and reduce the medical trends in future years. Another positioning issue that I might use is I may be concerned about the health of my employees. Perhaps they've been using a lot of sick leave for personal illness and injury. And I might want to use a wellness program to reduce that sick leave absenteeism experience and cost. I also may want to reduce some of my workers' compensation experience. So if I have the incidence of new claims seems to be going up, or the severity of claims seems to be increasing, then I might do some things in wellness to help reduce those workers' compensation experiences and issues around incidence and severity. Another positioning issue for wellness is to reduce disability insurance costs. So if I have a short-term disability policy that covers my employees, I provide the coverage to them and they start having things that are then taking them away from being able to work and it's not work related, then they start filing claims against that disability insurance coverage. And I might have long-term disability in addition to short-term disability. So the issues around in reducing disability insurance costs may be part of my positioning strategy around wellness. And finally, I may want to use the wellness program to increase productivity and particularly to lessen either the prevalence or severity of underlying health problems when people choose to stay at work. And that's what we call presenteeism losses. So I may want to reduce those presenteeism losses in future years by being able to help people avoid chronic illness and injury of various types and to handle episodic acute medical needs in a more intelligent or appropriate way. So those are some of the ways that I might position my wellness activity with my senior management staff. Now, in terms of the econometric assumptions around my ability to say that the wellness program has some economic value to us, is I may want to first answer the question, what economic variables do I want to watch and to represent to management and try to affect? And that usually involves, almost all cases, healthcare costs, particularly when healthcare costs are going up at a high rate or an unacceptable rate, higher than other things like the consumer price index or wages and earnings patterns. Those are things that then cause my attention to be focused on what can I use wellness to do to help reduce those future healthcare costs. I also then have a concern at times about sick leave usage. Maybe sick leave is being used up and people are not carrying over any balances of sick leave, and it's basically telling me that I need to do something to help reduce the occurrence of that sick leave. Another one would be workers' compensation experience. So if I am increased frequency of claims or increased severity of claims and size of claims, then I may want to be doing some things in wellness to help reduce that. I also may want to be doing some things to reduce the disability costs associated with short-term or long-term disability. And I also may want to be offsetting some of the lost productivity, where I've invested in wages and salary and benefit costs for employees, and when they come to work, they oftentimes may have an underlying health problem like a reflux condition or an upper respiratory infection or migraine headaches, and then I'm not really getting the productivity out of them, and that's called a presenteeism loss. So my wellness program can be intended to actually reduce that, and I may be making econometric assumptions about that. Now, econometric just simply means Anytime that I am looking at producing any kind of economic analysis or economic data on something like a workforce, that's my human capital. So I am going to make some econometric projections or analysis. I then want to make my assumptions explicit. So for instance, in terms of economic derivation, if I want to look at return on investment, I have to decide which of these five am I going to look at, and how am I going to examine this data to be able to relate it to the effects of a wellness program. Another area that I want to look at is each of these five areas has some economic costs that I can calculate, but who experiences the liability of that cost? So if I'm in an insurance pool for my healthcare costs, then if I improve the health of my employees, I may not benefit immediately from the reduced cost of their healthcare claims. So that would be a locus of liability issue. Who has that? Sick leave frequently is employer funded. Healthcare can be self-insured or it can be insured. So the issue is when would I see the benefit, the economic benefit of healthier workers? Workers' comp is oftentimes state-sponsored, state-pooled, and I may not experience that except in lower future rates, maybe modifier factors that are going down, so that I pay less as part of payroll taxes to support the workers' compensation fund in the state that I'm functioning in. Disability costs are usually insured, so I may in fact reduce disability expense for my population, but do I encounter a lower cost or premium on my plan because I do that? Or am I experience rated to some extent for those costs? And then presenteeism, I essentially have already paid people the salaries, the compensation packages. And now what we're talking about in presenteeism is actually getting more for the money I've already invested. But I can in fact put an economic value on the improved productivity of my employees if I'm measuring presenteeism in some valid and consistent manner. So that locus of liability is an important issue in my econometric assumptions about these areas. There's also econometric assumptions about work disruption. So if I am finding that these particular occurrences, accidents, injuries, sick leave, has other work disruption effects that I can either compute or determine, then I may want to look at some of that disruption effect and try to make some sort of sense out of it in an economic term and economic terms. There's also the direct cost assumptions about my program. What are the costs associated with my wellness program? And I generally want to stay direct cost oriented, which means I can track it. I, in fact, am paying bills and it's associated with the wellness program, and that is measurable and can be compared with direct savings. In addition, I may have some econometric assumptions about the baselines that I'm using. What years are our baselines? Do I want to use one or more years in terms of forming that baseline? And what are my comparison points? How am I looking at the metrics which have to do with these economic return on investment issues, and to what comparison groups am I going to look at the data? Also, whether I want to use constant dollars and or discounting in some form. So am I adjusting for the time adjusted change in value of dollars, what a dollar buys? And do I want to use constant dollars in my analysis, or do I want to discount at a fixed rate or a variable rate? So those are econometric assumptions that I make explicit as I do any kind of analysis that would look at the economic return from my wellness programming. I also have issues around timing and timing assumptions. So there I'm looking at when is the savings likely to occur. If I'm focused primarily on my wellness program on changing future chronic disease costs, that may not occur for a period of time. But if I've used things like medical self-care or consumer health information, or I'm using plan design modifications, the effect may be immediate. So I want to be able to have some assumptions, econometric assumptions about when the observed changes that I am bringing about with a wellness program are potentially observable and appropriate to be measured. And finally, the measurement methods come into play. So my econometric assumptions need to determine how is it that I'm going to look at the various economic derivations of my return on investment, and how am I going to actually come up with those savings and then make the comparisons with my direct cost. So in summary, these are the primary areas where we make econometric assumptions when we're doing any kind of return on investment analysis for a wellness program in a worksite setting. Now, I'd like to go through a series of statements with you, and I want to kind of position this so that you can get a sense of how you need to position with senior management the issues around the bottom line returns and impact of wellness programs. So we're going to go through 8 statements, and I'm going to give you the statement and then explain it and do some discussion on the issues that are involved in that statement. The implication here is that if you want to do this effectively, you're going to have to become familiar enough with these statements so that you can actually say them without prompting. So the ability for you to internalize this is important as you think about how you influence your management to think about wellness in a more strategic way and to think about the economics of wellness as well. This first statement is, wellness can help reduce the prevalence, and that's the frequency of what occurs. You know, it's broken up. Prevalence is basically the amount of occurrence of a particular behavior or risk over a period of time. Incidence tends to be new cases. Frequency tends to be the existing cases at any one point. The combination of incidence and frequency tends to reflect prevalence in an epidemiologic way. So we want to reduce the prevalence or the existence of a number of specific behaviors and risks in our population that significantly increase our health-related costs. And health-related cost, whenever you hear that in this module, means health plan costs, sick leave absenteeism, workers' compensation, disability insurance costs, and presenteeism. And also lower worker productivity. So in addition to these behaviors and health risks increasing health-related costs, it also undermines or lowers our general worker productivity. So that's the first statement that I want to get across to management. I want management to understand, as we talk about the discussion of this particular statement, that there is a real need for them to look at the workforce from a perspective that says there are things that people are engaging in and doing that they are not addressing or changing, and those things are significantly increasing our health-related costs and other lower and also lower their general worker productivity. And there's actually an enormous amount of literature in the epidemiologic literature that speaks to this issue. Some of the most prominent authors of this literature are Ron Getzell. He was heavily involved in what was called the HERO studies, the Health Enhancement Research Organization studies. You can go under their website. If you put that in your browser, you will find a number of studies that organization has published. Those are multi-industry, multi-employer settings where they've actually looked at the relationship between specific behaviors, health behaviors, and in clinical risks, and then looked at how much they increase health-related costs for given populations. So the authors that you want to look at are Ron Getzell, Goetzel, and it's Ronald Z. Getzell, and I would recommend strongly that you do a Medline search on him as the primary author or one of the authors, and that will come up with a whole series of articles that are excellent. In addition, people such as Dee Eddington, who used to be at the University of Michigan's in the Department of Kinesiology and in the Health Management Research Center. That would be another source that has done a great deal of research on this issue. Wayne Burton, who is a medical director at Bank One and also currently at American Express. These are people that have done extensive research on looking at the relationship of health risk and health behaviors. We also have a module, another CE module, that goes deep into this particular area. So there's a great deal of literature. David Anderson would be another person to do a query on in Medline to find out what articles he has published. But there is a pretty extensive literature out there about the relationship between specific behaviors and health risk, clinical risk, behavioral risk, that in fact increase significantly the amount of health-related costs. And the more medical or clinical or behavioral risk that an individual has, the more geometric increase of costs. Some of the studies show relationships of 8 to 12 times the amount of healthcare use in someone with multiple risk factors. So that's what kind of caused us to want to focus on the segment of your population, working population, that have multiple risk issues. So what you're doing in this particular case is you are getting your own grounding in the reality of this statement, and then you are using selectively articles that may relate to your industry, or they may relate to the age and demographic characteristics of your population. Lots of different ways of doing the research and showing your senior management group some of the findings. And so the ability for you to know that this is a starting point where you're basically saying to management, we have things going on in our workforce, and Dee Eddington has been one of the most significant contributors to the realization that if we do not do some things to help people stay low risk, they will gravitate toward moderate risk and high risk. So they will get more severe risk, and they will get more of them if we simply let them kind of pursue the normal path of aging. So that's some of the issues around this particular statement when you make this to senior management. Statement number 2 is our employee health-related costs include health benefit costs, sick leave absenteeism cost, workers' compensation cost, disability insurance costs, that include short-term and long-term disability, and presenteeism costs. And that the national studies that estimate this cost averages approximately $37,000 per employee per year in these 5 areas. So that's taking a number of national studies. You can find studies that vary in terms of their methodology and their cost quote, but the idea is we're looking at least $30,000 a year per employee. So we can affect a significant portion of that. Some actuaries have actually projected using existing minimal levels of effectiveness of our current interventions that we can affect about 20% of that. So that would turn out to be a 20% of that, even 30,000, which would be about $6,000. So the ability to provide a $6,000 per employee benefit to a company, if you are going to implement wellness in a reasonable fashion, is not too far-fetched. So the ability to have a significant economic return as part of our thought behind this particular area. So some major issues around our discussion of this statement. First of all, that you need to be able to position to management that it's not just health plan costs that we're concerned about. There are 4 other types of cost that employers experience, and that total, those 5 areas, are consuming a significant portion of the compensation costs that are associated with a given employee group. So you can use these national studies. The best data is really some data that's been collected for your own employer. So if you had your own cost to put in for that 37K, that would be a much more powerful approach with your senior management. So the ability for you to look at a broader range of economic variables, the ability for you to use national data to help establish at least an initial interest on the part of your management in looking at this option and alternative, and then your ability to help them actually capture data which reflects your own employee experience is really kind of critical in terms of taking this particular statement and have it have the greatest influence on your senior management team. Statement number 3 is as follows. Wellness can be done in many different ways depending on what goals we choose for our wellness program. So we'll stop right there and do a little bit of discussion on that first part. That means that there's getting across to your senior management that it isn't just doing wellness as only one way. There are multiple ways of being able to do that. And we actually want them to understand the implications of those different ways, and we'll talk about that in a follow-up statement. But the idea is that there are many ways for us to be able to do wellness, and a critical issue is what goals do we have for our wellness effort? So that really says, and you should be saying to your senior management, that it depends on what you want to accomplish with these programs. If you don't want to accomplish much, then not much is going to happen. But the goals, or the second part of the sentence is, the statement is, goals determine the targets. So if we have goals that have to do with reducing sick leave, then that tells me I have to do some targeting in my program and some interventions around those targets that we choose, and they need to be able to be effective at reducing that particular area of a metric for our population. These are the 2 keys to wellness program effectiveness: the appropriateness of my targeting and the appropriateness of my choice of interventions. And when I take my targeting and my interventions together, we call that execution. So if we execute wellness well, we in fact have chosen the appropriate targets that are related to our goals, and then we've chosen interventions to use with those targets that are in fact the most effective. So those are keys to our wellness program's effectiveness. So from a discussion context, we want our senior management to know that there are different ways of doing wellness, that our goals for our wellness program actually drive and should drive our choice of targets, behaviors and or issues that we attempt to work with. We oftentimes call those prevention targets. We then have a series of interventions that we want to align with those targets to affect those targets over time. And that's what we call the results-driven wellness approach. These are the 2 keys to your wellness program's effectiveness. Statement number 4 is this. Wellness experts strongly recommend that employee wellness programs be designed to improve health. We need to get health improvement out of our wellness programs. We need to also improve employee morale, and that's the issue around how people feel about their employee or their employer and what they in fact are thinking about. And we need to increase employee productivity and reduce health-related costs. And again, health-related means all 5 health costs. So that's the context for our discussion of this particular statement. The implications are that you need to use some outside experts, people who have been doing this kind of activity. Now, I am considered an expert in this because I've done 1,000 of these programs. But there are many others like David Anderson or Michael O'Donnell or Joe Lutzinger. Okay, a variety of people out there. David Anderson, Seth Serksner, Neil Sofian. There are lots of people who have done a lot of wellness, and they basically will tell you wellness programs need to address a number of different potential outcomes. And these are 4 of the key outcomes. So you want to be able to get your senior management to understand that people that have been doing this for a long time are pretty animated toward making the programs have multiple effects. Rather than just doing a program that improves morale, for instance, that won't affect those other areas, improving health or improving productivity or reducing health-related costs. So that's some of the issues around this particular statement. Now, statement number 5 is in terms of reducing health-related costs. Now, that was the last item we just saw from statement number 4. So we're carrying forward on that concept. A typical employee wellness program will usually produce a return on investment, an ROI, of at least 200% after a year of programming in either health plan cost reduction or reduction in sick leave absenteeism cost. So the context and discussion here is that we need to kind of under promise and over deliver. So I can show you pretty extensive literature that says that these kinds of traditional wellness programs will generally produce about 300% return each year. But I adjust that downward because I don't want to overpromise and underdeliver. I want to underpromise and overdeliver. I want to be able to have them thinking it's only going to be this much, and then it's instead of X, I want to actually give them X plus Y, so that they in fact are pleased with the fact that they're doing wellness. They see some economic value in it. And the 2 areas that are most extensively analyzed for return on investment in wellness are health plan cost first, and secondly, sick leave absenteeism cost. So we also have the Backer article and Cutler and Song article from Harvard, published in the 2010 time period for, I think it's the February edition of the Health Affairs. And that was a meta-analysis of some 22 studies looking at health plan cost effects of wellness programs and 22 studies that were looking at sick leave absenteeism cost effectiveness. And they basically came up with, after looking at those studies, that for each dollar spent on wellness, there was approximately $3.23 of reduction in the cost of health plan, so about 323% return. And then for each dollar spent on wellness, there was a concomitant 2.73% or cost benefit yield in terms of its effects on a sick leave absenteeism cost. So the combination of those was 1 to 600%. So the idea that you are looking at health plan costs and you're looking at sick leave costs to get some sense of the value of your wellness effort. You can add the other 3 variables, which are the workers' comp cost issue, the disability insurance issue, and the presenteeism issue. But at minimum, we want to look at least one of these 5 areas, and the most typical ones are health plan cost and sick leave absenteeism cost. So this particular statement is actually a conservative view of what we have in a literature that comprises approximately about 120 or so articles that have examined the economic return of health promotion and wellness programs for employees, and have been published in peer-reviewed journals where there's a blinded process for having peers review the quality of the research and the write-ups and the studies and the analysis. So that's statement number 5 and some of the issues that have to be around that. But it's a fairly significant return on investment for a business to be talking about a 200% return. Most businesses are in the area of maybe 12 to 25% rates of return, much smaller, or much lower levels of return. Now, statement number 6 is the choice of what prevention issues we address and the interventions we use for each of those prevention issues will largely determine the results we get. Now, results can be either value on investment, and that's things like retention and recruitment, morale, and so on, or return on investment, which tends to take us back to any one of the 5 economic variables and then compares the cost of the program to those savings generated in various areas. And the discussion here is the emphasis for our senior managers is that we have choices in front of us. We have to decide based on our goals what we're trying to accomplish. And then we choose the prevention issues or targets that we want to address. And then we decide what are the interventions we need to use in order to affect those issues. And that will then determine the results that we end up getting. So our choice of what we do in terms of programming, whether we fund the program at an adequate level, whether we resource it with people and staffing and volunteer time and attention from management, those are all part of the choices that we have ahead. Statement number 7 is a popular way of thinking about worksite wellness programming is related to the program model the employer uses. So we're talking about the general model. We also call that the strategy. It's the overarching strategy that we use. The 3 models that you are familiar with from the WellCert program include the feel-good wellness model, the traditional wellness model, and the results-driven wellness model. And the feel-good wellness model is simply a morale-oriented improvement type program. So that's a wellness program that helps people feel good, gets them working together better, but doesn't necessarily affect the underlying behavioral or clinical risk factors. And then a traditional wellness program begins to start working on some of those, but it basically sets out a whole bunch of options and alternatives so that we set up a bunch of services and a bunch of opportunities for people to do wellness. We don't measure it very effectively, and we basically don't have a real strong approach to it, but we give people opportunities, and then we are generally an activity-oriented approach. So the traditional wellness program is really focused on head counts. How many people participated? How many people were involved in this activity or that activity? And we're not necessarily results driven in our approach, so we aren't reporting on health improvements or changes in attitudes or consumer skill levels or how they're using their health plan or other kinds of more higher level results. Now, the results driven wellness model, from your exposure to the material in the WellCert program, the results-driven model is where we start to get more serious about wellness. We include productivity and different dimensions of productivity. We start to kind of think about how do we build these programs with more extensive targeting and more extensive opportunities and options for interventions. And how do we get the interventions supported by strong benefit-based incentives so that people pay less, for instance, for their premium contribution if they engage in wellness. And then we start thinking about integrating our programs better, getting a better policy framework, changing the worksite environment more significantly, involving spouses. So we begin to do things in wellness that are going to have much more extensive effect on those particular health-related and wellness-related issues, well-being issues for our population. So the discussion around this area is we need to kind of get people and get our management understanding there are different ways of doing wellness. We use the 3 models to illustrate the kind of clustering of types of approaches to wellness. So the feel good is not going to produce a results-driven wellness set of results. A feel-good wellness model is going to get you involved in wellness. It's going to improve morale, but not necessarily affect underlying health behaviors. The traditional model is going to get you a little bit in that direction, but not necessarily very far down that road. The results-driven wellness model or strategy will in fact get you into much more serious population health management kinds of activities. So that's the important thing with this particular statement in terms of being able to help your management understand the different ways of doing wellness. Last statement, statement 8, is if we want to achieve the goals of improving health, improving employee morale, increasing employee productivity, and reducing health-related costs, then we have to target and execute the wellness effort in an appropriate way. So this, in terms of our discussion, is we've got to bring management back around to see that your goals and what you want to accomplish with the program have to drive how you implement wellness, what model or strategy you use, how extensive is your funding of it, what do you do to support it with policies and with norms in the worksite, how do you integrate it more effectively. So I have to convince management that if they want to get a full set of results out of wellness, then they need to do wellness in a way that's going to produce those results. So in summary, we've gone through 8 statements that you have to internalize. You have to kind of get a feel for them so you can put them in your own words. And then you need to be able to say these things to management, either in writing or in a face-to-face meeting that allows them to understand, oh, now I understand. We can't just do wellness in a feel-good kind of way. We can't do it in a tactical rather than a strategic kind of way of approaching it. So that tactical wellness program that many employers are stuck with because they don't want to spend more money and they don't want to do more about it, does in fact have the effect of lowering the results of what the program can do. So if you want to help management see that they can get more results out of their wellness program if they're willing to commit the resources, time, and attention and policy focus on it, you can in fact make it a much more of a strategic business imperative rather than a tactical business solution that they kind of tack on to something else. So that's the context for these 8 statements that we need to use, I believe, in being able to position our wellness efforts appropriately with that top tier of management. Now, an inconvenient truth when we look at the 2 issues of how effective our targeting of our program is in terms of its behavioral emphasis and looking at behavioral issues and clinical issues, and we can look also at how good is our execution, how good is our implementation, our choice of interventions, how well we actually put those interventions out to the people that need it. If we look at these as 2 major variables and we look at kind of a good and a poor for each, we end up with what's called in business a 2x2 analysis. And it means that if we look at existing wellness activity on the part of U.S. employers, and there are approximately about 8.5 million U.S. employers, of the ones that are doing wellness, and that would be probably about 70% of them, that about 5% of all of that wellness activity would have both good execution and good targeting. That's a relatively small amount. So we've got 5% of the wellness that's out there. It's probably pretty good quality. Okay. Now on the other hand, we've got about 10% of that wellness activity in U.S. employers that has poor targeting and good execution. So they haven't done a very good job of really, setting the goals for their program or identifying the types of behaviors and issues they want to address, but they do a pretty good job, and that gives them, some reasonable results. There's also another 10% that have good targeting, they've chosen good targets rather than poor targets and good execution, but their targeting is good, but their execution and implementation is poor. So we've got another 10% that are in that category. And some of these, by the way, we can find articles from a lot of these areas, but I would say the majority of articles in the literature, those 110 or so that look at economic return, I'd probably put a big chunk of them in that upper left-hand box of the 2x2 analysis. They're in the good execution, good targeting. And then we've got about 75% of the wellness that's currently going on in American work sites that I think have both poor targeting, meaning that their goals are not aligned with what they're approaching their program with, and their execution is pretty poor. It's not adequately funded. The choice of interventions is not appropriate. The necessary ways in which you need to roll these interventions out to have them be effective is not pursued. So we've got about 3/4 of the wellness that's going on in the U.S. that I would put in the category of poor targeting and poor execution. So our need is to help more people. For instance, if they're down in the lower left-hand corner and they've got poor targeting but good execution, then they need some work on targeting. They need to choose better targets that are aligned better with their goals. Or they also need to take their goals and reframe them so that they provide more of the potential of what these programs can achieve. The same thing is true in the upper right-hand corner of the 2x2 analysis. And that would be if their targeting is good and they are doing that correctly, but their execution and implementation is poor, then we need to work with them to actually get those activities improved in terms of execution. That would then mean we are trying to increase the numbers that are in that 5% box and have that go up. We also want to reduce the numbers of employers that are doing wellness where the targeting is poor and the execution is poor. So we'd like to see that 75% number go down and the 5% number box go up over time. So this, unfortunately, I think is the inconvenient truth we have in the field of wellness, which is a lot of what we're doing in wellness has been oversimplified. The employer has gotten stalled and has primarily a tactical orientation to wellness and not a balanced strategic approach to wellness. Now, reasonable expectations for the different models that we've talked about. And this is just simply giving you more of the main features of each of those models. And our primary focus is what we kind of say this particular model addresses. So the feel-good model, strategy and program model for wellness is really more of a morale improvement oriented effort. The traditional wellness program in most employer settings is activity oriented. We want people to do something. We aren't tracking it, we don't know what it means or anything else, but just get them out there doing something. And then the results driven is where we put in place a much more extensive, serious approach to population health. And there we're looking at a hierarchy of results and we're measuring those results and then feeding it back into improvements over time. Now, if we take each of these three models, the expectations for ROI that we might include for the feel-good, it probably doesn't pay for itself. So if you invested $1,000 and you got only $600 of return back, that would not be a very cost-effective way of addressing a specific issue by that activity. So in the context of the feel-good wellness model, we don't have much evidence in the literature that it's going to produce and pay for itself. It might if you chose one or two interventions that were particularly effective, so it could happen, but it generally doesn't happen. And in the traditional wellness area, we're looking at somewhere around 150 to 300% return. A 3-to-1 return on investment, which we have right now, at least 14 studies that I'm aware of that have gone all the way to cost-benefit analysis, basically reflect what a traditional program would achieve. And then if we cut that in half, we basically are talking about 150. Now, in a previous slide, you saw the number 200. So that was simply downgrading that 300 by a third to get to that 200% return. So if we lower that even a little further, we come down to 150% rates of return on our wellness program. And again, most of the time that's going to be either in health plan cost or sick leave, but we could in fact include those other three economic variables and actually increase our ROI significantly. That's another issue in our field, is that no one has looked at all five. They only look at one or two and then make statements about the return on investment or cost beneficial nature of wellness, but they're undercounting much of its effect. So we have a lot of undercounted studies that are only describing and defining ROI based on one of the five economic variables. So if we limited our approach to one variable out of the five, then we would expect 150 to 300%. The Harvard study that I mentioned by Backer, Cutler, and Song essentially looked at both sick leave and medical plan cost and looked at them separately. And they found that the two of them together were close to 600% return. So we can in fact have much higher rates of return if we're willing to look at the economic variables that are associated with the issues that wellness programs address. In the results-driven wellness model, if we were to choose that model that has the main features you see in the box in front of you, that would give us a higher order of magnitude of ROI, and it's a significantly higher magnitude. The highest that's been reported in the literature is actually 1900% return on investment each year, but that's what I would call an outlier. We also have one that is a 16 or 15.6 or 1560% return. So we have some, then we have another one that's a little over 1000% return. So you can find these in the literature, but in general, we want to under-promise and over-deliver. So we don't want to hold out unreasonably large amounts of return, because if we're not able to achieve those, we generally will cause management to say this doesn't work, even though it's producing a very high level of return. So the results-driven wellness strategy or program model will produce somewhere in the area of 250 to 650% return each year, particularly if we are looking more broadly. But these estimates are really based on one economic variable. And again, that understates, because we're taking all the direct costs and aligning it and weighing it against only one economic variable and the savings that are associated with that one variable. Now, a summary of key points. There is an extensive scientific basis for the economic return associated with worksite wellness initiatives. Is it all randomized controlled trials? No, because we don't have any public funding of research around worksite wellness. We have people that have done the research but have not necessarily done it in a publicly funded modality. So there's an extensive basis, and right now about 120 or so articles on the economic return of worksite wellness programs published in peer review literature or peer review periodicals. All right, however, many worksite wellness programs suffer from inadequate results because they are not appropriately designed or executed. So the words we were using there have to do with our targeting and our intervention and how we execute those interventions. The type of wellness program model you use needs to fit management's expectations. So your choice of feel-good, traditional, or results-driven needs to be aligned with what management wants to achieve with the program. Also, it's important that your econometric assumptions need to be reasonable and explicit. That means they need to be defendable and defensible, and they need to be made in a way that other people can read them and respond to them. How you implement wellness for your organization should be consistent with senior management's expectations for the program. So how you go about putting your wellness program together and actually implementing or executing on it, that should be consistent with what your management expects out of the program. Sometimes you have management that may be their expectations are too low and you need to help them increase them, but then also sometimes they're too high and you need to get them to adjust it given the resourcing and the amount of effort that they're willing to expend on wellness. When setting management expectations, it is always better to underpromise and overdeliver, not the reverse. It is reasonable to expect an ROI of 200% in healthcare costs or sick leave absenteeism reduction the first year of programming. Much of that is determined by your targeting and your interventions. Your positioning of ROI expectations with bottom line expectations with management needs to be based on a reasonable underlying rationale, design for your program, and your execution of that program. It is important to know which economic variables you will be measuring as soon as possible. So, given what your management wants to accomplish, if they want to tackle all 5 economic variables, that would have a lot of implications for the design of your wellness program, or it should have. It is important to know how you will be determining economic return as early in the development process of your program as possible. So the earlier that you know what you're going to be examining, the more appropriate, the better it is for you in terms of being able to execute well, design well. There are a large number of variables that can affect your ROI, so be careful. This is not a mechanistic endeavor. This has a lot of art and science in it. It has some complexity in it, and you need to be able to understand that, be appreciative and respectful of that as you work with management around this particular area. So these, in summary, are some of the key points from this particular module. Now let's handle some questions on some key issues in this particular area. First of all, what level of ROI do most employers usually project for their wellness programs? And I would probably suggest to you that the majority of employers that I've seen project what their wellness program is likely to return in terms of ROI is usually around 300%. That's fairly typical. You see that mentioned a lot. You can go down from that. You can go up from that. Again, remember, we want to underpromise and overdeliver. But it also requires adequate funding and management support. So we can make some sort of estimate, an expectation, and state those expectations, but if our funding of a program is not adequate and our management support is not adequate, then it's not going to achieve the ROI that we expect it to. The second question is, how do I create a reasonable set of expectations for wellness? Well, I think here's some suggestions for that. One, I would use the logic that stands behind these programs, and particularly what we call the results-driven wellness framework. So that's developed initially by Dee Eddington, and I've done some significant modifications on it. But the idea is that we're using logic and a metric-based approach to show management what the effects of these programs are and how to enhance them. I think we want to provide some examples to management, so we want to be able to point to some of the studies that have been published in the literature, particularly if they're with our industry or area of the country or type of interventions we're using. I think we want to educate about the complexity of what we're dealing with here. And we are dealing with human behavior. We're dealing with not mandatory behavior, but behavior that is voluntary in nature, so people have to want to do these things. And then I also want to use a clear framework to help my management understand some of that complexity. I want to use some personal examples, their own lives, their own efforts at change, as ways of helping them see in a more reasonable fashion some of those expectations they might have for a wellness program. And then I want to set up an evaluation process that actually gives me feedback. There's a feedback loop that I can take that back to help adjust unreasonable expectations and get expectations on the part of management into a more reasonable place. The third question is, should I share with senior management all the complexity of wellness? And my general response is no. I don't think that they necessarily want to hear it, but I think you want to provide an opportunity for those that are motivated to find out more of its complexity. You need to have some fallback kinds of things for them to read or to pursue, and sound materials. So the materials need to be good science-based, appropriate, respected by people in the field, but the ability for you to share that kind of thing with your managers and senior managers that particularly want to know more about the complexity. I think you also want to tighten your logic. So you want to have a logic framework that they can see, okay, we understand, where this is. And if we run into complexity, then your logic should help you be able to point out, oh, here's why this didn't work the way we thought it was. We didn't do this, we didn't do that. That explains some of this variation from expected. You want to acknowledge the complexity when you can. So you want to share that it is complex. They don't need to know all the complexity, but you need to know that and they need to know that you know the complexity. And I think you want to set up some accountability structures so that you can in fact use evaluation to help answer the accountability needs that your senior management has. So when things don't turn out the way they should, you in fact have some possible explanations for that. There are always things that are going to intervene in what our plans indicate. So those are some of my answers to some of the key questions that I think affect this particular area of the field. Now you've completed the module, go ahead and take the quiz.